From the Society for Radio Democracy 98.1 FM, and the same way so they get we live on the internet on www.radiodemocracy.sl. Mina Adeyemi Jackson, where they bring this edition of the program Midday Show come to you. Inside the program, we'll get plenty news, information, newspaper headlines, and all that things. So continue for day with me for the next 1 hour. The program is Midday Show. The program is studio guest this afternoon. Now, the Chief of Communications and also Resource Mobilization Focus 1000, where Medley Savage, we go talk about the progress on the Saving Lives and Livelihood Program Phase 2 project where Focus 1000, the partner, and the implement. Good afternoon and welcome to the program Midday Show.
Yes, good afternoon.
Well, that now my studio guest for today, we're now Medley Savage, we're now the Chief of Communications and Resource Mobilization Focus 1000. Continue for the with me in the program. You can be part of the program by way you go send message to the number 077-981-981, or you go now we get the Democracy Facebook page, so you will follow the program live. Drop your comment or question on the issue where we will discuss inside the program today. The program na Midday Show. The program na Midday Show, and they come to you live from the Society for Radio Democracy 98.1 FM. Inside the program, we start for look at issues. Also, the program manager for the expanded program on immunization at the Ministry of Health, Dr. Desmond Kangbai, say it's a one survey way then do show say, but 95% of people don't take the COVID-19, polio, smallpox, and other maclet them in the country. They talk this is a one engagement way Focus 1000. All with the Ministry of Health, Africa Center for Disease Control, and AMRIF Health Africa for look inside the progress with the Saving Lives and Livelihood Salon Phase 2 project to make now the well body sector. Well, for more on this, we intern reporter Abu Bangali to get more gonna report.
COVID-19 na virus wey been reach Salone inside 2020, and this virus can give diarrhea, sore throat, running nose, and plenty other sign them like cold. And this sick been kill plenty people and make people them be sensitive more, but how then they take care of themselves medically and how then they clean their environments them. We forsake at this sick will not be only torment the country but the entire world. Make Focus 1000 join on with Africa CDC, AMREF, and Ministry of Health for bring calm the Saving Lives and Livelihood Salon Phase 2 project. Where this now 1 year project where they run from January to December 2025. Now 10 districts them na Salone, and this project they target healthcare workman them, adults them we get plenty sick them, and people them we don't pass 65 years. This project now for give well body to people, get strength to the maclet system na the country, and self give maclet to people we get tendency for contact COVID-19. But how beneficial maclets don't dey to Salone, and waiting at the thing them what we don't achieve as a country. The executive director for Focus 1000, Alhaji Mohammed Jallo, explained.
When we talk about immunization, that has been one of our greatest tools in public health, in addressing epidemics, in trying to deal with the issues of children and women, in saving the lives of children and their families. We're able to eradicate smallpox globally through immunization. We are now at the verge of eradicating polio. We've reduced the incidence of measles, tuberculosis, diphtheria, a lot of other childhood diseases through immunization. So we value the importance of immunization, and immunization we do in partnership with the Ministry of Health. Ministry of Health has the responsibility and the lead. Our funding support from organizations like AFINET, African CDC, the United Nations, especially UNICEF.
We're in the talk for sake of the maclet business na the country. Make the program manager for expanded program on immunization na Ministry of Health, Dr. Desmond Kangbai, explain how far they don't go with maclet business na the country.
Immunization coverages across the country, I think it's very good, but even with that,
we are still having some outbreak of vaccine preventable diseases. So that's why, as we are doing our interventions, we are now also moving, not only looking at the quality, the coverages, but also looking at the quality of our interventions. Because you can give a vaccine to a child, but maybe you didn't store that vaccine properly, and then the effects of that vaccine could not be realized. So we are now also looking at the quality of our intervention. How could we look at the data, and from the data we interrogate the data, and we look at the quality of our intervention. For our immunization coverages are now above 95%. And also we have come up clearly with strategies. That's why we look at our data, because reaching 95 sometimes is easier, but getting the remaining 5% becomes very difficult.
How dem don dey work for give sabi to community people, but Maclate make the community engagement officer na Salone Red Cross Society Stephen Tamba Senesi explain.
Before this time, we have a root of denial in terms of accepting the vaccine when you go down to the communities. It is not easy for us to convince them. Use their people, use their children in terms of volunteers to see how best they can talk to them, sensitize them, bring them on board to accept what government is doing, that they are doing something very, very good for them. But with the power of God and also our efforts, Leone Red Cross Society as well as Focus 1000, we achieve. Now we have a roadmap of acceptance of vaccine.
Stephen Tamba Senesi and say them go continue for give them support to partner them for see say people accept for take Maclate all over the country. For the Society for Radio Democracy, Abu Bangali Ture the report.
The program La Midday Show, and they come to you from the Society for Radio Democracy 98.1 FM. You can be part of the program by way you go send message to the number 077 981 981 077 981 981, or you go on our Radio Democracy Facebook page. Also, you go drop your comment or question on the issue where we discuss inside the program today. As I mentioned earlier, I say today in my studio guest, now Medley Savage, we now the Chief of Communications and also Resource Mobilization Focus 1000. And in there for talk about some of the progress them where they don't make, like the Saving Lives and Livelihood Project Phase 2, where Focus 1000 and the partner them they implement. Once more, good afternoon and welcome to the program.
Yes, good afternoon and thank you for having me.
Before we can start for look at the Saving Lives and Livelihood Program Phase 2, generally people will go the listing, Radio Land, and also now the Facebook page. Go and forget the background. What they bring about this project?
All right, the Saving Lives and Livelihood projects now one way MasterCard Foundation and African CDC and that of AMREF. They support Focus 1000. We're not the implementing partner. For instance, we look at vaccination, and also we try to look at the livelihood of Africans. You know, we all know vaccination is one of the major issues that we have been having. We don't get Sierra Leone. Sorry, I want to go into English. We don't get Sierra Leone. So in that regard, the funding partners decide for come up with this particular project where now they run from the 1st January to the 31st December. However, that's not we call it the fiscal year, but the implementing period now from March to July. So we just don't complete the implementing period. So now we did try to look at the fiscal year where they run from January 1st to the 31st.
Now a 1 year project?
Yes, now a 5-month project, but the fiscal year now just 1 year.
Okay. Let me go back into, because now the implement phase 2 of this this project. Let me go back into phase 1. How phase 1 be telling?
Okay, phase 1 will be described for strengthening the health system, because we realize we health workers they need more know how for address some of the emergencies they already get. Like for instance, when we get the Ebola, or we get the COVID-19, we realize there were challenges after we don't roll out then particular project, and they will realize it, then we get some challenges. So we look at those challenges and say, okay, let's come back to the drawing board and let's try to see how best we go will address that. So we try for strengthening the health system, by supporting health workers, training them, and also training the community health workers equally.
Okay. You say una come up with this idea under the phase 1 project because now identify some weaknesses then now the health sector, and una try for provide the necessary support to body will command them. What's now some of the weaknesses there, so we wanna be identified, and what's now the different support we wanna give so far?
All right. So firstly, we try for we don't say the teams they will be the go out for go do the vaccination, the outreach team. Then we get major issues like the team they not be sufficient, so we try for recruit more vaccinators. We go increase the uptake of vaccines, and also we try for train the health workers then, because we realize as part of, because Focus 1000 we get the 4 approach. We for the first one in our evidence-based approach, that is we want to get evidence for any implementation they do. So we realize the people then they get some they get issues with the way how the health workers then they attend to them. Sometimes you realize you can't you picking tell and say, or the man can't in picking you tell and say, why you carry time, why the mama not carry time. Do you understand? So some of this problem be they come. So we decide, say, okay, we need to train them, let capacitate them, let them know, say, you approach to the patient firstly, very important. So if you give the patient that confidence, say, where I come for can't treatment or neither for can't vaccines, if you attend to me well. For can't tell me, say, you can close your reg today. You understand? So all of those we try for look at the ethical standards and procedures and other things within the districts and other areas there.
Now they look at the ethical standards and in terms of procedures of how well body will command and they respond to patients and where they go and the health facilities also for different services there. Will not be able to achieve some of them things here?
Yes, I think we don't try for changing narratives. Kudos to the Ministry of Health, and also kudos to the EPI expanded program on immunization for them support, because we don't realize now, we don't see we health workers are now then very professional. Even when they give you now, when they give you the vaccines, you go realize the feel. We'll get that kind of fear that these vaccines it can cause problem for me, because they will attend to you. And again, before we take the vaccines to the various locations then for the health workers and go do their work, we do a groundwork. That is where they go soft on the ground, tell people them about the benefit of those vaccines. Why you for take them? You understand? Why you not for be left out? We don't realize we picking them. The vaccine are like it go support your immune system. If we not give you picking them, you understand, I may could get a lot of child mortality and other things because of them in the day. So
we can look into the aspect of vaccine and which one I think of vaccine in the country. If people don't respond to vaccine intake in the country. Now we come into phase 2. Now when are they into phase 2? The phase 2, which one are the targets? Okay, the phase 2, actually
we do a close out yesterday where we do experience sharing. We do an country lodge where we get development partners. We get the Ministry of Health BDD. We get civil society organizations. They all be there. We try for look at what thing we don't achieve so far, and the lesson they would all learn from the phase 2 project. So in the, yesterday we share some gains that we'll be able to train 204 vaccinators. We give the help we follow, we get the increase in the uptake of vaccines. Also, we don't also try in this phase 2. We don't try for install the vaccination stations. Now 2 districts, one western area, urban, and the other one Falaba district. Then vaccination station here go help for support, the ministry for let them do their work, and so we will get increase when it comes to vaccination.
Okay. Continue for the with me now the program. In name Melvin Savage and in the Chief of Communications and Resource Mobilization and Focus 1000. Continue for the with me now the program. The program na midday show where they come to you from the Society for Radio Democracy 98.1 FM. The program they continue with the look at another issue. Some people where they beg along the Kisi Road and Mountain Court area don't allege say some police officer then can beat and take them property them anytime they're gonna treat for big. Then people are talk. This is one interview with Radio Democracy. We then they talk about the challenge them way that they face na treat. We reporter Josephine Freeman gets more in one report.
Tin for eat and sigh for sleep. Now one part the major challenge where Baku people they face na salon as tin the tranga every day na the country. And this don't lead to the pasmak big where some people can do na treat. And safe, some can sleep na treat. More like young people because they're not able to afford for pay for rent owes. Now for sake of this, make some people can sit down na some side and a free tongue for big and fender and tumult. But for no how life don't turn like for them people they make Radio Democracy bingo waka na Kisi Road and Magazine Court. Usai people where they beg can sit down.
We not get some money, we not get what you do. Pass it and some of who don't hold. Some of who not get picking again when they able to stand for it. I make good the cash on at least for bigger. They would blind man. They would tell other one way and get them broke of food.
I don't go my shishi, I go my shishi, and what time say, they're not for doing operation. I get cancer. That's what makes me I get picked all they go school. When no day, I make a common street and what I survive me picked.
Well, you know good na me ato, but for I not get possible they maintain for me. As if I ready for go you want the one place, I tell her say you now look for me now picking the house.
They five people now right now me picking you see for go from one. But one not get money for pay for that. Let's then I not get money for pay. Any day they cry,
Well, better no day. The other work today, parce me, I not get person for help me for me picking them. Now make a consider now.
That's the voice of some people where they beg along Kisi Road and Magazine Court. They talk about the reason why they decide for go na treat for beg. As then go before, for talk about the challenge where then they face anytime then they not treat for beg.
We will not get some money, we will not get to not devil in a more boku, look what the pass look at them. You go miss up in the boku. So I don't got them people there waiting tonight. The police they not agree. And they beat me. And we not so foreigner. So we not get no side where we worry.
Go the policeman and they give it chance. Go through the incident, they now why they go. All it tells us the way they can't go for try to for claim.
Then the only one they suffer. They carry go my second party. And the one that we don't go with me.
Then people say harassment and pasmak beats. Now some party team them when they can face from police officer them. We make I talk to the head of media na the Salon Police, Assistant Commissioner of Police, Brahma Kamara. But the allegation them where them beg a man they make against the police and at this it begets for say.
The police not get need for beat them, and as far as me concerned, police not they beat them, but police go move them maybe for some point if then they want somewhere they obstruct traffic or it obstruct the free movement of people. You go tell them to make them move. It not necessarily means say we all understand the situation. Say sometimes somebody they in a situation where they decide say, well me not go able to fend for myself except I beg for let people that give me. Some other people actually get the stamina, get the strength, but sometimes we see say a very lucrative for let it big, then it will still go big. So somebody will get so yacht. Somebody will see the need for give, he go give. That one day, I not go question somebody whether he get right for big or not big. Me not get authority there for question now.
The Assistant Commissioner of Police, Brahma Kamara, also say the police gets mandates for say they maintain law and order, control how people they get on a street or public place them. them people here where they beg believe say now where them gonna treat them can able get money for biting for it and solve them problem them we make they end up call on government and sorry at body them for support them with thing for it and side for sleep. For the Society for Radio Democracy, Mina Josephine Freeman, the report.
The program La Midday Show and they come to you from the Society for Radio Democracy 98.1 FM. I still get Medley Savage, we are Chief of Communications and Resource Mobilization at Focus 1000. You don't take me through the phase 2 of the project and the areas them we una they look at under the phase 2 of the project. As of now, who's on a day?
In as much as we try for integrate COVID-19 into we routine immunization, we also try for see how best we go able to get these mpox and other vaccines to fully we get high coverage in those areas. So we continue for push for strengthening the health system, and we will continue for push for ensure say we try for achieve the phase 3. We now another area where phase I go look into before I left the state.
Okay. On the try for getting to the health system in terms of which kind of support no one give under the phase 2, no one for give to the health system?
Well, as I said, the phase 2 already done count to an end from July. So now we the wrap up, we do the fiscal year now, we know the from now to December, but we don't come to an end. Yesterday we don't do the closeout. So the impact where we don't create so far, we don't ensure say we don't provide, we don't train over 204 vaccinators in 10 districts. We also don't support health care workers them over 200, and we also don't support the national immunization policy. We are a very good one for we as a nation, because as a country we actually struggle for get that documented. But inside this phase 2 we'll be able to get a national immunization policy we don't review, and we don't get a document now for support immunization.
And I think so not make any impact.
Yes, yes, because if we get the turnout to they get turnout when it comes to vaccination, kudos to the government and the Ministry of Health, that is the EPI, but kudos to the donor partners them with the support we, because when we reach there, we reach now the ground, we can able for soft on the ground. All them misconception that vaccine the kill, vaccine is this, vaccine is that, which is not true. But when you go down there, we're able to pass the right message. You understand? So through the support we'll get from MasterCard Foundation, African CDC, and AMREF, we'll be able to reach down there, and we're able to create the impact. We're able to get team members and we're vaccinators that will send out there, we'll do outreach. So it's not about static again. The vaccinators, and they go out now for reach out to the hard to reach communities like the riverine areas. We will see these are difficult terrains, we don't get low coverage there. We just send the vaccinators and then they go to their work and come back with the results.
And we're not only going to the ground for get a kind of feedback from people so far in terms of more especially the area of health workers them in terms of how they don't respond to patients and when they go to the hospital.
Yes, okay, fine. Before we come to the patient them, the healthcare workers them equally, we are the frontline workers them, also this particular project cater for them. We try for get themselves vaccinated, for we prepare them for any emergency. So again, themselves, when we talk about the ethical standards, we don't train them, then we actually be don't trained, but we don't try for do a refresher training for them, so then we're able for attend to the people that really come for can take the vaccines.
Okay. We can look at the aspect of vaccination in the country. It is very key. We don't see whenever there is an outbreak of disease or sickness, we don't see how people don't respond to vaccine. When they say people have to go take vaccine, let's take for example the COVID-19 vaccine. We see the kind of slow pace at which people will take the vaccine because of the fear of certain things. Them they all look into the area of vaccination from Focus 1000 point of view. What will una general take in terms of vaccine taking now the country?
All right. I go confirm say, as a nation we don't try. We actually don't, increase the coverage for vaccine in Sierra Leone because Usa Obide and Usa Ode now we don't come out far. We don't make the gains. Yeah. But again, when you come to Focus 1000, we get, we community engagement structure. We they use for reach out to the farthest district and the farthest community and the chiefdoms. How we get the Kumbra network. The Kumbra network made up of religious leaders. We'll get the Islag and the Christag. We get the Imam and the pastor in there. We also get traditional healers. We get the media. We get in the civil society organizations. We have market women and youth groups. So when we want do the community engagement approach, we use them trusted voices there and send them down to the communities. Then they go meet some people and pass the message, because the message is as good as the messenger. When we send them trusted voices, when they go down, then go soft on the ground and tell the people about the reality of those vaccines. When the health workers they go do their work, it will be easy for them. People they accept the vaccine. So the acceptance rates in this country is very high. That I can testify to that. And I will tell you again, we religious leaders then get major role for play. Because I do recall yesterday somebody shared a testimony. He said when them we go na a particular district, then we get stuck because the religious leader, the imam, afraid for take the vaccine. So all the people there around them not take the vaccine. Not a particular region there. But when then go then pray with the imam and educate that imam, then tell them about the benefits of that vaccine. The imam they say charging 4 phones to put up for his, when not getting the vaccine, after not getting the vaccine, if they feel say he will die the next day. After he survived that, when you say nothing happened, he grab strong health and now pass, continue for pass the message, and we get high rate on that particular district day when it comes to the coverage.
You say the coverage in terms of people where they take vaccine don't increase. When I get any kind of data where they show, like say from this figure to this figure in terms of the coverage of vaccine taking don't increase.
Yes, we get an increase rate of 65%. We was confirmed yesterday by the statistics and data unit. Yeah, so we get 65.
How do I reach to that 65%?
Well, when we do the vaccination, when we send the outreach team, then they go with a recorder. This recorder, they record anybody we didn't take, they record and put under the database. So we get all them figures that we come in, and from any month we put them together, and we can get the result.
Okay. Continue for the with me in the program in Melvin Savage and in the Chief of Communications and Resource Mobilization now Focus 1000. Continue for the with me in the program. The program na midday show and they come to you from the Society for Radio Democracy 98.1 FM. You can be part of the program by way you go send message to the number 077-981-981 or go navigate the Democracy Facebook page, drop a comment or question on the issue we'll discuss inside the program today. Inside the program now we go for this break. Society for Radio Democracy 98.1 FM. Inside the program, I still get Melvin Savage, we're a Chief of Communications and also Resource Mobilization of Focus 1000. And today we look at some of the progress them way they make that the Saving Lives and Livelihood Program Phase 2. We, according to Ram, just done. Melvin, we don't talk about the phase 2 of the Saving Lives and Livelihood project. You say when they come go into the phase 3 of this project again. The phase 3, what's the target?
So we hopeful for going to the phase 3. Yeah, so we are hopeful. It's a hope. So the targets, in every project we implement, you get forget lessons learned and challenges. We can take them lessons learned and challenges in the back to now drawing board and try for work on those and design and develop other activities we go fitting to which we don't do, but it will be different, be too far different from which we don't do in the phase 2, because the phase 1, if you take a look at the phase 1 and the phase 2, then get some alignment. So if we go phase 3 again, you'll get some alignment again, where then will look similar.
Okay. Continue for with me at the program. In Melvin Savage and in the Chief of Communications and Resource Mobilization of Focus 1000. This is the program where they look at another issue. The European Union Ambassador in Salon, Jacek Jaskowski, say one part the reason we make when they support poor community them na Salon now for reduce poverty in our people their life. They talk. This is our meeting with farmer them na Warre village na Benin Chief Dog Cambia district where we command them na the European Union delegation go work and then community them here for know how the EU funded project done the help improve the community and also the livelihood. Well, for more on this, make we join Alaji Jalom.
That's na community people from Warre village, Bile Chiefdom, Cambia district. We welcome the EU Bus Tour 2025. Now the community inside 2023, President Julius Madabio will launch the Feed Salon program for Sise Salon people, plant waiting in the eat, and self-support local farmer them with fertilizer, seed, and other one them, so that government will reduce the way out and the import rest them na the country, and self-strengthen the food system and sustainable agriculture for farmer them na the country. But with this, private sector and development partner them get big role for play so that government will able achieve the Feed Salon program. As the European Union delegation and Salon, na body we don't support Salon, but different sector them na the country, like infrastructure, agriculture, and other one them. With this then support really don't they help Salon people make the EU Bus Tour 2025. The work in a community them, who said that they bring development for see our community people and serve the project that help for change community people in life.
I would like to witness how the EU project has changed your life. The idea behind the project is not to support you till the end of our lives and our children's lives, but to give you a chance to be independent. Give you a chance to work, to generate profit for you and for your family. The idea behind the European Union intervention here in Sierra Leone in the village of Warre. So let me see the project and let me hear from you, directly from you, how your life has changed.
The voice where you just listened to, now the European Union delegation ambassador on our Salon, Jacek Jankowski, but they talk about the reason they make European Union, they support community people them in the country. As they don't support farmer them, where they cashew farming, now Warre village, Bile Chiefdom, Cambia district, make the EU Bus Tour 2025. Meet with community people for know how this project will help for change their life.
Me na Mame Sise from Warre community. Today, we no been there for this cashew business. The community will be there bien. But through the intervention of this cashew project, it helped we a lot. The cashew helped we a lot because the benefits what it don't give it during those days. So cashew projects not been there now with community. Today, we not be no say cashew. If for plant other thing among especially potato, not be no say for plant among cashew.
My name Mohamed Sajo. So well, this it don't help we greatly. We don't harvest honey, that it don't benefit we because we understand say when the honey grew and the cashew in flower, now the more the cashew they born, and then the more the honey back pull in honey. Then when you pull them, we don't sell that honey there. They don't give you beaucoup money. They don't change your life there. They don't change the life of picking a woman there.
I don't benefit me. We say we don't go plant the cashew. We don't plant the half-half thing like cucumber. Then the benefit we before cashew dey born.
From Bile Chiefdom, the EU Boss Tour 2025, the same way so waka na Royak Village, Mambolo Chiefdom, usai Naxa they implement the proper growth for peace consolidation and youth employment projects where the German Development Bank they support, where this na part of the European Union then work, where they don't they help Salon people for tap they challenge them, where farmer then they face and self community people na Royak Village, where make community people they meet and talk with the ambassador for talk about how this project don't help tap and challenge them, where they be they face na them community.
Gare wo binde na one get me the machine pass we train boat we cross na rishino na dey we dey go beat we rest them we dey harvest we dey mass we rest them we put an house then the thief am but right now we take go thank you na bin get water wo dry season kana pass you go na makoto you go na gbonkomoria una train boat wo water don dry na water wo then dey no fine for drink but right now we take go thank you we ready pump banka we dey get water we take go thank you for the nasa then do all for we
Naxa Dawit for we. Number 1, drilling machine. Number 2, dry floor. Number 3, we count it for we solar. Number 4, we count for we pump. All thing that will not be get an hassle.
Na Mambolo we go with phone for go charge. We pay transport for go Mambolo 15,000 for go. We go charge the phone. But right now Naxa don't benefit we because we know they sort in fire. 24 hours we get fire.
Then people end up for tell thank you to the European Union for the support where they don't they give them. This project don't help tap them, challenge them, don't help for improve them community and serve them life them for the Society for Radio Democracy. Me, na Alaji Jalo, they report.
In the program and media show, they come to you from Radio Democracy 98.1 FM. And they come over to me, studio guest when I met Savage, Chief of Communications and Resource Mobilization at Focus 1000. You talk about the current state of in terms of vaccination in the country. And according to you, the survey wanna gets that 65% of people they take vaccines in the country. Which type of vaccine then we wanna target so far?
So the targets go first now. We look at the healthcare workers, frontline workers. These are the first target. The second target now the aged, 65 and above. And people living with comorbidity, like diabetes and other things. So these are the targets people we target for this particular project. So again, if the survey where we conduct, we say 65%. Now like the data, like we record and they go out and get details and carry them for we. They record, following and provide for we. We put them together, we get that. And this don't support we advocacy. It don't support we and help we for convince governments and also convince we policymakers because as I be state we not be able to get the immunization policy, but with this we're able to convince and policymakers now we don't get immunization policy would help with greatly. So the target group like for the health workers, we also don't support them greatly with their ethical standards and professional work. We also then don't be two heroes and for this country because they don't take their vaccines and we don't get huge turnout.
65%, you get about 35% more. We still not take or not take vaccine in the country. The balance of them people and they waiting at the easy way. Some of our staff then say about them balance people and or which plan will I get for bring them on board?
Well, we continue with the advocacy. We continue for doing community engagement and mobilization for see how best we will get people on board. Sometimes now they hard to reach areas, difficult terrains, now we can get them challenged in there. But as we continue for reach out and continue for do we work, we will continue to talk to them and so go get the remaining 35%.
Any reason the way people don't give before as to why they not be they take vaccine?
Yes, one na fear. This fear factor. People feel say it's not safe for them. That's now one major factor. because I don't recall when they carry this COVID-19, the vaccine, people then feel say, no, it's not good. You not get the quality. I mean, too standard for it and take them, and people then get that notion say, African they say no more, so then decide not for take them, and these are the reasons why make people like take the vaccine, not for take vaccines.
Okay, let me go back into the Saving Lives and Livelihood project. Now, which areas they want to keep the target so far?
Well, the target group that I don't name so.
No, in terms of the areas they want to implement this project.
Okay, we do attend the streets. Now we do Koinadugu, Falaba, Kono, and Western area, urban, and the yes. Again, we go Falaba.
Not
10 districts.
Not 10 districts.
Yes.
Why? Because we get about 16 districts.
All right. Based on we evidence we'll get, because so we groundwork. We realize that those 10 areas then get low coverage. So we try for see our best. We go enhance we presence, and also we workforce for ensure people then we will get the figures out of those areas.
But you not get any kind of plan for expand our project into the other districts and we not benefit it?
Yes, that's the part of the plan. But those districts are like they are the champions. Like they actually don't stand out when it comes to vaccines, because they can always they on top of situation whenever we vaccines roll out there. So we period them vaccines roll out, they will support.
When I believe say or think say when I don't create any kind of impact at any district here, so in terms of vaccination.
Yes, because if we look at the coverage now, we don't get it don't go up, as to which will be the get, for.
Will not be the previous percentage, because you mentioned about 65%. Will not be the previous percentage before?
Well, that I'm not going to get off here, but we did very low, but we don't shift them up to 65%.
Any project getting your couple. So waiting at the total couple will evolve into this project.
This project maybe do something like it's 265,570 USD.
What are they fund this project?
The MasterCard Foundation, and then pass on to Africa CDC, and African CDC pass on to AMREF. Africa AMREF now, work with Focus 1000 and other implementing partners.
Will they work with the well body sector?
Yes.
Well body ministry?
Yes, because we know we work without the government and the ministry. So we therefore complement the work of the ministry. And I make anything we do, if you realize this project, we support usually the healthcare workers, and for strengthening the health system. That is key. Follow support over 50 PHUs. Now this 10 districts where I highlight. Follow support over 204 vaccination we provide 2 vaccination stations. Now 2 districts will also get challenge. It's huge. So we actually strengthened government work, we strengthened the ministry, so they're able to do their work. So we cannot work without the government. Thanks to the leadership of Dr. Kambai.
In name Melvin Savage, and in the Chief of Communications and also Resource Mobilization Focus 1000. Continue for the way to the program. Inside the program, we look at another issue. Inside the head of media, now the Sierra Leone Masters Athletics Ibrahim Okunkuwomase, the marathon where they organize now for people where they do athletics for say they're able to get this sabi for but the sport, and also boost the tourism sector in the country. It talk this for Seka 1 day marathon where the Sierra Leone Masters Athletics organized for athletes in Salon, Liberia and Djibouti. For more on this, we intern reporter Alfred Jana gets more in report.
September, some athletes them they come together and set up the Sierra Leone Masters Athletics with the aim for bring together past athletes them and see how they go able for take part in marathon for the aged and active And this BNTM, this organization, hold this marathon na Aberdeen Beach. Outside them bring together athletes them na Salone. Outside different athletes them come together na Salone, Djibouti, and Liberia. But why this marathon important? The head of media na the Sierra Leone Masters Athletics, Ibrahim Okonkuruma, talk more.
Well, it's very important because Masters, as you don't hear from other speakers, them we executive member them. Masters na like we go say veteran, like people who don't play ball and say come back, not let this one. That means they are resting, but they are called active rest. So this Masters program, they all over the world. You get Masters in America, you get Masters, we got fifth, so within Africa, they all sign at the world. Well, of course, this is the first marathon combined with able athlete, we'll say, or active athletes and athletes already under Masters. Masters are from 35 upwards. Yes, well, we get 42 kilometers because we look at the age. We get from age 45 upwards, and then 5K from 35 to 40 years, and then the 10K now, and that of the half marathon, Emmy Open. So you wait, Ross Shiboni go inside. So that one day, it's so wonderful, and when I see the prizes, the Odongi, it's so fantastic.
The head of media, now the Sierra Leone Masters Athletics, Ibrahim Okonkuruma, go before for explain, but how somebody go qualify for take part in this competition?
No, everybody, as long as you're 35, everybody involved in this, whether you don't be former athlete, whether you're not an athlete, you be part of well, and one of the things the way, my brother, this question very important. Most people the way don't see where they die out of obesity. Then they fat, then body, then belly, then the big, they not actively they do this sport. So we want to raise the awareness, let people see the need for physical exercise, not only coming to Masters, but also raise the awareness, let people know say them for one way they don't pass 35 or way they don't 35.
The Salone Athletics Association, now the umbrella body for all athletes in the country, we make the president for this association. Yaya Mansare say with this kind of competition go help for the train to the country tourism to more opportunity them.
Thank you. This is a day for celebrate. Sierra Leone Athletics, Sierra Leone Masters need to celebrate. We need to celebrate. It's been a long time we wait for something like this. As a family, this is what to see, bringing everybody together. Sierra Leone Masters, kudos to you all. Kudos to you all. You've done it. And as a federation, we make sure these units they exist because we want people to augment the efforts of the association. We can't do it all alone. The more you create activities like this, the more we sell out Sierra Leone. And today, you see how Aaron demonstrates for Selby County out. Djibouti is here. Liberia is here. What would they imagine next year? Would I go there again? Kenya will be here. I think if you're there in sports, this is the right place to be. I want to stand on their behalf for telling them this message reach them and they appreciate all that you are doing because what you will do now for help government to augment some of the issues the way governments are going to reach at. Now we responsibility as Sierra Leoneans to organize things. We want to tell them plenty thinking. For the one that come from different countries, Djibouti, Liberia, I want to say thank you. And for us the host, I want to say a very big thank you.
The president of the Sierra Leone Masters Athletic, Martin Momo Bangura, end up for say because of how this important to the well body of people make him call on young people then. For engage by them kind activity for the society for radio democracy. Me na Alkejana the report.
The program now media show they come to you from the Society for Radio Democracy 98.1 FM. I still get Melvin Savage, we are the Chief of Communications and Resource Mobilization now Focus 1000. So now they go now into phase 3. When the phase 3 they start?
All right. We actually know prepare for that. We not get confirmation from the donor partners. But we hope for start within the next fiscal year.
Okay.
Yeah. Because this one the end December 31st, 2025.
This year.
We just done the implementation phase.
Okay.
We're in for March to July. This year we just done them. So the fiscal year start from January.
The fiscal year now within the bot.
The period for the project itself. So from the 1st January,
that's the time when they begin implement the project.
Yes,
proper
everything involved. So from January 1st to be don't start that to the 31st, now the fiscal year, but implementing period now from March to July when I be 5 months we don't complete.
Okay. We also understand that now they also into outbreak emergencies. Waiting these outbreak emergencies about.
Well, when they talk about outbreak and emergencies, now if you go back to this Saving Life and Livelihood project, we try to integrate COVID-19 into routine immunization, and now we advocate for we get them into routine immunization, because we won't forget we have prepared for any outbreak. We come now and say you come, prepare something like that can happen. You can't even go back helter and skelter for put yourself together for face any emergencies. So now we try for our best. We go get that routine portfolio. We then they go help